So this session, WA Response to COVID-19, it's my great pleasure to introduce Dr. Darren Gibson from the Department of Health. Darren is currently the Director of Research and Innovation within the WA Department of Health, and as a researcher, I think this is a very, very important position. The department supports and promotes high-quality research and innovation in both WA Health and the wider WA Health and medical research and innovation sector. So I'd like to welcome Darren. Thank you.
Thank you, Sue, for that kind introduction. And also thank you to Gary and the organising committee for allowing me to present here today. Is there another clicker? Before I start, I'd just like to pay my acknowledgements to the land that we're meeting today and the Noongar elders, past, present and emerging, and it's such a privilege to be on their land today, so thank you. So I wanted to sort of provide this, or just a brief outline of what I'm going to present today. And before I really go into talk about our interaction in the COVID-19 response, I wanted to touch on the Future Health Research and Innovation Fund, because it's critical to our involvement in COVID-19. And then I'll talk about the sort of timelines of some of the activities that we were undertaking throughout the last year. A little bit on ethics and governance, and then some of the lessons that we learned throughout the year and where we're sort of going now. So I'm hoping that most people in the audience know about the Future Health Research and Innovation Fund, or FHRI. This was passed in legislation in the middle of last year, so towards the end of May, and it came into Act in June. And it really is to set sort of the vision for WA, and to become a global leader in health and medical research and innovation. It's got wide-reaching sort of benefits, really, from not just from the health, but the economic, the reputation, the impact, the culture, and also fundamentally the partnerships. And this is really what the fund's trying to do, is trying to sort of create an ecosystem here in WA around sort of health and medical research and innovation, but in partnership. As Peter mentioned earlier today, the collaboration between the universities, the health sector, consumers, etc., is critical for everyone to go forward. And so that is what we're trying to sort of emphasise through the Future Fund. There's a strong link to the Sustainable Health Review from the Future Fund, as the DG mentioned earlier today. It's the sort of blueprint for health for the next decade. And we really want to sort of ensure that research and innovation are at the forefront of pushing the health system forward. So with that, within the Future Fund, there's an external advisory council being established, and it's ministerial appointed, and the chair being John van der Wielen, the chief exec of HBF. And there's some eminent academics and industry leaders throughout the country that are part of that. Within the Future Fund, we have to set sort of strategy and the priorities, and the inaugural strategy and set of priorities were developed in partnership with many of you in the room today. And it's really under sort of four themes, the strategy: people, partnerships, policy and platforms. And really we wanted to emphasise the word sort of people, because it is critical to everything that we do, and that people is the health professionals, the researchers, the consumers, the people with lived experience, policymakers, etc. The policy theme is something that the department has to take carriage of, and there's very little funding from the Future Fund going to that, because we're trying to ensure that all the funding goes towards the research activities. Some of the activities in policy, meaning sort of ethics and governance, IP, etc. But within the legislation of the Future Fund, COVID-19 was highlighted as a key priority for 2020-21 financial year. And it was within this legislation that we were able to act and move things forward. So now touching on sort of really the COVID, and I just wanted to talk through some of the key activities that we've been undertaking over the last year. So I'll show a very brief timeline of some of the activities, then go into some more detail. So there's a large piece of work around sort of with our counterparts over East to develop sort of national statement, which I'll talk about in a minute. The modelling project, or projects really, that the Director General and Andy both mentioned this morning were critical to setting the pathway, and it was our first series of funding to sort of funding COVID activities, and that was through partnerships with UWA, the epidemiology branch, etc. within health. Then in April we had the first full research round of COVID funding, and that was funded through Department of Health at $3 million. Peter mentioned some prototypes that were also developed. We supported 3 of the ventilator projects with some really sort of proof of concept funding, and that was critical. And as Peter mentioned, that was within sort of days that we went from sort of concept from Peter giving us a call to actually providing the funding to them. There's a project called Detect in schools, which I'll talk about in a minute. And as previously mentioned, the Future Fund Act came into play in June, having COVID-19 as a key priority there. Later in the year, we had a second round of COVID funding, and this was the first round of funding from the Future Fund itself, and there was an investment of $6 million. And finally, in October, we had our first real forte into the innovation sector. We provided some significant funding to a local business. So I just wanted to go into some of these areas in a little bit more detail. So the first activity back in March was really all the sort of jurisdictions getting together to talk about how can we actually move COVID forward, not just the COVID research, but also the significant amount of research that's currently happened, and can that continue. The stance that WA took, and most of our counterparts over East, was that non-COVID research can continue, even though it will be problematic for patient recruitment, but there was no reason to stop that. So some research did continue, a lot did stop because of patient recruitment issues. But we released a joint statement with our counterparts to really outline how research can be conducted during these challenging periods. The other main aspect we did was working with the NHMRC and our human research ethics. So there's 3 ethics committees that are being certified from the NHMRC, and we worked with those ethics committees and the NHMRC to develop a pool of HREC members that if COVID really did hit and the modelling was true, that we wouldn't be able to meet face-to-face. The HRECs wouldn't be able to meet, therefore we couldn't do the COVID research. So we had to think of a different way to potentially approach that. And so a pool, sort of essentially one ethics pool was created. And the NHMRC were really supportive of that idea, and that was put in place. Thankfully, that wasn't required, but it was something that it might be useful going forward. Also back in late March, early April, the Guardianship Administration Amendment came through for medical research, and this was allowing people that don't have capacity to take part in research. This was seen as critical because so many of the patients that had been seen in Europe never had consent to take part in research, and we thought to ensure that they had the capability, this was forced through the Parliament, I think, in one day. And a big thank you to Daniel Fatovich, who was the spokesperson for health within the pit within Parliament, and did an outstanding job. So really a big thank you to Daniel. And really now we're starting to see patients being recruited through this act across the health system. The first significant funding was back in April time, where we released $3 million. And this was really a partnership between ourselves and WHTN, so a thank you to Gary for assisting us with this programme. We had, I think, one weekend to review over 80 applications, and a big thank you to really all the panellists who were involved in this process, because we did destroy the Easter weekend, but we did have some excellent applications. The applications were of fantastic standard. The interest from the whole sector was amazing, and there was a panel that was chaired by Peter Clinken, where we had researchers, health service providers and consumers all involved in that. At that time, decided collectively to split the funding, not just into research, but to underpinning infrastructure. So a significant amount of that $1 million was dedicated to biobank, to set up a COVID biobank project under the leadership of Toby Richards and Aaron Shakira. This was sort of essential because we wanted to ensure that instead of the short-term project funding, long-term infrastructure was key for not just the COVID research, but long-term success of the health and medical sector here in WA. Most of that funding was dedicated to interventions in testing, because at that time it was decided that that was the current thinking and what we really needed to do in WA. But there was still some funding supported to other projects. So like Alan James was supplied some funding for the Bustleton cohort to look at mental health impacts. There was significant challenges for these projects, which was fortunate but unfortunate at the same time. Fortunate that we never had the COVID wave that was going to hit WA, so definitely fortunate for the WA population, but unfortunate for a lot of the projects who couldn't actually reach the recruitment targets and seek the testing that they required. One of the projects later on in May was seen as significant, especially for the schools and everyone to get back to work, was the Tech Schools. This was in partnership with Department of Education and Telethon Kids Institute. They decided to do sort of rapid testing to the school environment and to test the population to see if COVID was prevalent there, and then also to do a psychosocial study to look at the long-term impacts of COVID and the lockdown to the school population and their families, etc. The testing, again, similar to the first round of COVID never really resulted in anything being detected, so that sort of stopped quite early. But the psychosocial study was still continuing and will be finishing soon. COVID round 2 was where we really started to go into the future funds, and we had 3 streams of work. So research, infrastructure and innovation. It was our first true test into innovation, but again we saw infrastructure being a significant component. Merrily Needham will be talking quite soon about Transform, which was one of the key infrastructure projects. And this was really a mechanism we thought of to really push the infrastructure and again cementing that sort of fundamental capabilities in the state. Just conscious of time, later in the year we supported an innovation project which at sort of $500,000 about rapid testing, and this was really our first major win in innovation, and it's been supported and going from strength to strength, and as Peter mentioned earlier. I just wanted to briefly mention ethics and governance. This slide and the next slide, very similar about ethics and governance approval. The main thing just to really point out is at the start of the outbreak, sort of in that sort of March, April time, approval times for both ethics and governance were extremely low and quick, which is fantastic. All other research was impacted, unfortunately, but latterly, everything sort of moved back into sort of essentially one area, sort of COVID or non-COVID research. So with this, and just to finish up, is really where we're moving next. So we wanted to learn from COVID, and we're just finishing off an HREC review, which was started at the middle of last year, to really look at how do we get best practice for ethics approval, to ensure that we could get them in timely and efficient processes. And we're about to start a governance review now as well, again to look at how do we ensure that governance is being approved quickly and timely. We also, because of the challenges of reviewing projects, we've opened up a registry for reviewers, where instead of the traditional 5 or 6 reviewers, and then we went to a pool for COVID round 2, we opened up to the whole community, and so far we've got I think, about 180 people that are interested in becoming reviewers for the Future Fund, which is a great testament to people's interest of assisting the Health Department and the Future Fund Council to move forward. So in that, we're hoping to learn a lot from COVID work and really push the health and medical research forward. Thanks very much.
Thanks very much, Darren. We have a little gift for you from the Conference Organising Committee. We have time. I think we'll keep it to one question just because we are running a little bit late. Do we have a brief, to the point, succinct question from the audience? Okay, well, I have one. So, is there a role for industry? Is there a role for industry in this consortium of the community, consumers, health and academia?
Short answer, yes, 100%. So with the Future Fund, there's two streams of work, research and innovation. And we want to work with startups, medium-sized businesses, full industry to really sort of push the whole agenda forward. So yes.
Thank you very much. As someone working in that space, I look forward to talking to you again.